And I would like to say thank you so much to our Executive Director, who's also the Women Rep Garissa County, Madam Amina, and to our women reps from Mandera and Garissa County, and our MP, thank you so much for making this happen. So I'd like to talk about our initiative for a moment. We've been working on several pillars, including climate change, sustainable development, but today we are here because of health. And health is also one of our very core pillars as USDI. And as most of you know, we have been popular for the blood donation drives while we were still operating under the umbrella of Udgoon Foundation. And for us, we believe that even such drives are really important because that drop of blood could be a lifeline to someone who needs it. And
Representative Honorable Amina Siad, Member of Parliament present, healthcare workers, partners, all protocol observed. Good morning. So on behalf of Beyond Zero, I wish to extend my gratitude and appreciation for the warm welcome to Garissa County. We are delighted to be part of the ongoing fistula camp with the hope of restoring women's dignity. Okay. So on behalf of Beyond Zero, I wish to extend my gratitude and appreciation to Garissa County for the warm welcome. We are delighted to support the ongoing fistula camp with the hope of restoring dignity for women suffering from fistula. Beyond Zero is an initiative of the former First Lady, Margaret Kenyatta, and we've invested and supported fistula camps in various counties, and we continue to do so. We are also committed to raising awareness of fistula and supporting surgical repairs, together with our partners, AMREF, Health Africa, Flying Doctors Society, M-Pesa Foundation, and other partners in the same space. Thank you
for honoring us. I'm here on behalf, and Kiambo, I'm here on behalf of the Flying Doctor Society of Africa's CEO, Tanya Ndwati. The Flying Doctor Society have been in existence for 50 years now. We work with like-minded partners such as AMREF, Beyond Zero, UNFPA, and the M-Pesa Foundation. We've so far transformed the lives of over 1,800 women, and we're continuing to do so. We are thankful to the county for this very, very good initiative. And let's continue to change the lives of many, many more women. Thank you.
Honorable Amina, Members of Parliament, Honorable Deko, Honorable Anne and Suleka, distinguished ladies and gentlemen, good morning. I stand before you today on behalf of AMREF Health Africa in Kenya to appreciate the continuous support the county government of Garissa has given AMREF over the years in various projects, more so the fistula project, which we all know is a very devastating condition that affects our women, and that's very preventable. AMREF has been over the years implemented this project in various strategies, which will range from prevention and management through creation of awareness at the community level, capacity building of healthcare workers, surgical interventions through the fistula camp that we have here today, advocacy, and social reintegration of the survivors into their families and communities. AMREF has been doing this greatly with support from UNFPA. UNFPA is our key donor into implementing this project, and we work closely with M-Pesa Foundation, Beyond Zero, Flying Doctor Society of Africa, county and national governments to carry these camps across Kenya. And we're here in Garissa today, and I really want to thank the team here, from the county to the social media houses, IF team, Kulmia FM, also had Real Media, to be able to create awareness of this.
Viongozi wetu, MP, women reps, na partners wetu, na kila mmoja ambaye amehudhuria, hamjambo. Yani furaha kwetu kukua mahali hapa. Hapa leo tunaongea juu ya M-Pesa Foundation. Najua tunajua ile M-Pesa ingine, lakini leo tunaongea hiyo M-Pesa ingine imefanya nini na inaweza kusaidia zaidi ya pesa kivipi. So tunafurahia kwa kuwa mahali hapa, na M-Pesa inazingatia sana program ambazo zinalenga wamama. Kwa muda tumekuwa tukishirikiana na partners wengi katika miradi mingi ambayo inahusu wamama. nimekuwa tu nikiangalia kwamba kufikia Disemba kuna kamp zingine 4 katika sehemu mbalimbali. Ninaonesha tu ya kwamba tumezingatia mipango na miradi ambayo inalenga wamama, kwa sababu kwa muda walikuwa wamesahaulika. Kwa muda imekuwa ni jambo ambalo halileti maendeleo kwa usawa katika jamii. Na sasa foundation pamoja na wadhamini wengine imekuwa kwa muda tukishirikiana ili tukuwe na programs ambazo zinalenga wamama.
Garissa, assalamu alaikum. Wala taalimia salaamta xogo waa hooseysa maxaa jir. Aniga waxaa la yidhahaa Zulekha, waxaan ahay nominated MP women rep ma ihi, laakiin waxaan ahay MP oo la soo magacaabay aqalka baarlamaanka. Waxaan sala joognaa Udgoon iyo Majadeeqo baarlamaanka. Marka maanta aniga Ingiriisi Swahili ku hadlayo maxaa yeelay dadkii meesha fadhiyo Soomaaliya u badan, dadkii maanta dhan hadlayna Ingiriisi Swahili ku hadlay. Marka waxaan rabaa inaan dhahaa maamooyinkeennii, gabdhihii maanta horta maalin oo aad iyo aad u farxad badan waaya. Arrimihii annaga qaaska noo ahaa noogu muhiimsanaa ayaa wax laga qabtay. Waxaa waaya arrinta maanta intuu joogna reproductive health system waxaa la dhahaa arrimaha qaaska dumarka u marka annaga Soomaali haddaan ahnana arrimahaas xoogaho ma ka hadalna, banaanka ma keenna, waa yar qarsanaa wax yar. Midda kale aan kusoo dhameynayo waxaa waaye Udgoon khayr Allah siiya, waa gabar aad iyo aad u wanaag badan. Waxay mar walba ay ka fikirtaa dumarka Garissa. Adiga horta gurihiina ma qasaarnid.
Ya kwanza yangu ni kwanza kumtolea shukrani kwa wahisani Amref Foundation, Flying Doctors, M-Pesa Foundation, Beyond Zero, and Udgoon Sustainable Development Initiative, na wale wengine, na especially also the Garissa General Hospital, PGH Referral Hospital, wawezesha hii function ya leo or hii camp ya leo iwe as successful as it is today. Mimi kama area MP nashukuru hawa kwa hii initiative, na inshallah we expect them to give us more support in the near future.
Mko wazima? Naitwa Ann Moradha, Woman Rep Kiambu County. Mheshimiwa MP wa area, Mheshimiwa Woman Rep wa Garissa, na Mheshimiwa wa Mandera, na support team hiyo yote yenye iko hapa kuanzia Safaricom. Tunawashukuru sana kwa sababu ya kuona mkitumia fuliza. Hii fuliza inatuguraga pesa mingi sana. So leo tukiona mahali inatumika tunashukuru. Tunakuwa tu tukiuliza hii fuliza hii inaenda sana, inachukua pesa mingi, na bundles pia zinachukua pesa mingi. Na kwa hivyo leo tukiona ikitumika Safaricom, please note we are very excited. Tukiona tukiwatumia, umetutumia kwa muda. So when we have time to use you, we are also very excited. So among all of you, na wale wote wamekuwa mahali hapa, I think the one that has excited me most is Safaricom. Kwa sababu wanajua vile tunapelekananga. So wakati wameamua kurudisha mkono, we are very grateful. Beyond Zero, we will forever be grateful. Kwa sababu ya kazi ambayo mmeweza kufanyia wamama na vile mmeweza kuwasaidia hata kufikia mahali hapa. Na hao wengine pia ambao wana support hii kazi ya wamama na kurudisha dignity ya kuja kutibu wamama. Na mimi ni rafiki ya Woman Rep wenyu, tulikutana naye siku ya kwanza nilipofika bunge, tukapaa pamoja na nikapata kasichana kako na roho safi kanacheka tu, na tukakuwa marafiki tangu siku ya kwanza na mpaka siku hii ya leo tumekuwa marafiki na tumeandamana pamoja. Nimepata jina naitwa Fadoza. Kwa hivyo tutakuwa tukiendelea hivyo. And I want to say, ukiona mtu ambaye roho yake ni safi, hata matendo yake inakuwa safi tu kama yeye. Usitake kuwa rafiki na mtu wako na roho mbaya. Fanya kazi na wale watu wako na roho mzuri, kwa sababu hiyo roho mzuri inakujaka kwa mikono inakuja kwa uso. Sijui kama umeona watu wengine hata kucheka inakuwa shida, na hata akicheka ni kama anataka kulia. Lakini wale watu roho yao ni safi, hata kabla hawajacheka you are able to see. Mama ambaye ana hug wale ambao walimpatia kura. Nashukuru kwa Mungu kwa kunipa mama kama huyu ambaye amekuwa ni rafiki yangu, na ningeomba ya kwamba muendelee kusimama pamoja na yeye ili aendelee kutusaidia. Lakini zaidi ya yote, Amina, ningekuomba tafadhali utuletee Amref Kiambu, na siku hiyo uhakikishe M-Pesa wametuletea hiyo pesa yetu. Nafikiri kwetu ndio wanatumiaga ile mingi. Tafadhali M-Pesa as I leave this place.
Honorable colleagues, partners, doctors from this general hospital, the community, Assalamu alaikum. Let me start by welcoming our guests and partners to Garissa County. Wa mradha rafiki yangu Zuleka, mheshimiwa, karibuni sana Garissa. The journey to this day began in May. I knocked at the doors of UNFPA representative Mr. Anders Thompson, seeking for partnership to address the issues affecting women and girls in Garissa County. Mr. Thompson was gracious enough to open the door that 4 months later has given the women suffering from fistula in Garissa County and neighboring counties an opportunity to live a life of dignity again. Ladies and gentlemen, I am delighted today to see over 30 women smiling again after many days of suffering and despair. The story of the women who are recovering in the wards after undergoing successful treatment are full of hope, optimism for the future, which is in line with the theme for this camp, restoring the dignity of women and girls in Kenya. Courtesy of this camp, over 200 women have been screened so far, and we expect the numbers to rise as we get to the home stretch. All these women, in one way, have received medical assistance, and I thank the county, Garissa County Medical Fraternity for the good job that they have done. Women with fistula continue to face several challenges, ranging from psychological problems, physical health problems, marital problems, and sexual and reproductive health problems. Fistula not only inflicts physical suffering, but also shatters the dreams and hopes of women it affects. Many of these women are young with their entire life ahead of them. Ladies and gentlemen, honorable colleagues, the high incidence of fistula and other gynecological cases here in Garissa and Northeastern at large can be attributed to a combination of social, cultural, economic, and healthcare system factors. Many women in this region may not have access to skilled healthcare providers during childbirth, which is a significant factor in the development of fistula. Social economic factors such as poverty and limited access to education can exacerbate the risk of fistula. Women may not be able to afford proper healthcare, and lack of education may lead to delayed or inadequate medical care during pregnancy and childbirth. Limited awareness about fistula and its prevention is also a major contributor to the problem. The above factors, coupled with the social stigma and isolation, discourages the affected women from seeking help or sharing their condition with others. Honorable colleagues, ladies and gentlemen, I acknowledge with thanks the effort of the partners here today who have worked without ceasing over the years towards ending fistula and continue accelerating efforts to uphold the dignity of women and girls in the society. My office is privileged to have worked together with the Ministry of Health, County Government of Garissa, UNFPA, M-Pesa Foundation, Flying Doctors Society, Beyond Zero, Amref Kenya, and Udgoon Sustainable Development Initiative to put up this fistula camp. The camp has enabled many women suffering from fistula from within Garissa County and neighboring counties to overcome the financial burden that hinders their access to treatment. You have supported capacity building of health workers, community mobilization, provision of hospital equipment, funding of fistula repairs, and rehabilitation of fistula survivors. My partners, I thank you very much. I also appreciate the media, Kulmia FM,
and Iftin FM, who provided priceless publicity for the period of 2 weeks ahead of this camp, and are here today with us to ensure more awareness to the public as the camp continues. Asanteni sana. Honorable colleagues, ladies and gentlemen, this camp is a testament to our collective commitment to addressing one of the most pressing healthcare issues facing women not only in Kenya, but also around the world. We have come together with a shared purpose to bring hope, healing, and dignity back to their lives. However, let us also remember that this camp is just one step on a longer journey. Our mission should not just be to repair physical wounds, but also to restore lives and empower women to reclaim their rightful place in this society. To achieve that, honorable colleagues, ladies and gentlemen, we must raise awareness to educate communities about safe childbirth practices, the importance of timely medical care during labor, and the devastating consequences of obstetric fistula. Pledge to break the stigma associated with this condition and create an environment of acceptance and support. Advocate for policy changes and increase investment in maternal health to prevent fistula. As I conclude, I commit to the champion for ending fistula both within and outside Parliament, and I urge all of us to continue playing our roles. By doing so, we will restore the dignity of women and girls and shall create a brighter and more equitable future for all of us. Therefore, I thank my partners.